Good afternoon, everybody. Welcome to our briefing. We have not been with you for some time in this format, and we appreciate you joining us again. Today is January 13th, 2022, so also welcome to the new year. Today, we are here to share some updates about what is happening with COVID-19 in Eau Claire. Joining me today is Dr. Mohammed from Mayo Clinic Health System. Thank you for joining us. He advises the health department on communicable diseases and is one of our local experts in our community. So we're glad he took time to join us today. Again, today we're taking an opportunity to give some updates. We'll have an opportunity at the end for some questions from the media. We are available for questions in an ongoing way, certainly, and a reminder that you can call our health department 715-839-4718, and someone will get back to you about your COVID-19 questions. You can also always go to our website, and I'll share that website a few times because, again, some people are still learning about that, but it does have a lot of good resources, and that's COVID19eauclaire.org. So, Dr. Mohammed, again, thank you. Mayo infectious disease expert is joining us today, and he's going to share a few thoughts with you, and then I'll come back with some of the local data. Go ahead, Dr. Mohammed.
Yeah, thank you so much. So good afternoon, everyone. Thank you for the opportunity to participate in this media briefing. I hope I will be able to provide useful information to the audience. We are still within the COVID-19 pandemic. We are still seeing an increasing and a rising wave of infection, and this time it seems to be more infectious process happening. Increasing COVID-19 cases are impacting the other areas of healthcare. We need to continue to follow the safety measures that are effective. This including vaccination, masks, hand washing, and social distancing, as directed by the health agencies. Thank you again for the opportunity.
Thank you, Dr. Mohammed. And both Dr. Mohammed and I will be available again at the end for some questions from the media. Healthcare, as Dr. Mohammed said, is impacted by our increasing cases. I'll walk through that for you a little bit now. We are at a record number of cases of COVID-19 in Eau Claire. We're not surprised. We knew that this would be the experience with the Omicron variant when it arrived. Other nations, other parts of the US have also had this experience. The models that we are watching are predicting that this peak will be a couple weeks out, but we do right now have a straight line up in our number of cases. There'll continue to be many positive cases of COVID-19 in Eau Claire over the next several weeks. At this point in time, the data at a state level shows that about 82% of tests done in Wisconsin are analyzed as being of the Omicron variant. Again, a small sample of tests get looked at by reference labs, and 82% of those right now are that new variant. Over the past 7 days in Eau Claire, we've had 1,487 cases. That's about 212 cases a day just in Eau Claire. That's double what we had last week and triple what we had the week before. So a really rapidly increasing number of cases per day. You may remember, again, that we really want that case number to be as low as possible so we have slow spread happening. And right now, we are not there. This is our highest number of cases per 7-day period ever in the pandemic. So as Dr. Mohammed said, we are still in the pandemic. We are still seeing a high volume of cases. Our positivity rate is at 29.2% today. A reminder that our ideal is at 5% or less. That does mean that we have rapid spread of disease, likely many, many more cases than what we just reported to you, and likely that testing volume is lower than what we want, which we'll be talking about in a minute. We know that we are on the upside of the curve. We know that those case numbers will continue. With that increased case number, while many people have minimal symptoms or no symptoms, and we know that about this variant, it's a math problem. So the more cases we have, even if a small percentage of them gets hospitalized and a small percentage of them die, it's still a larger number of people. Our goal right now is to help our hospitals and our healthcare systems have as few people coming in that really need that most urgent care for COVID-19. They have lots of other work they need to do, lots of other work they want to be doing, and we need them to be doing. So if we can help them, we can work together to have the fewest number of people, the curve lasting hopefully a little longer but lower. So you may remember many, many months ago, we talked about flattening that curve. We're in that space again. Even if you aren't worried about getting seriously ill from COVID, and you may not be because of your vaccination status, because of your health status, there are others in our community that are at risk. And those are the people that we need to think about protecting. While it may seem like we've tried hard with this pandemic and there may not be many things that we can still do, there are still some things that can be done right now while we are in this big surge. Certainly, as Dr. Muhammad said, getting vaccinated, staying home if you are not well, washing your hands, getting tested, keeping your group small are all some things that we can do. Testing is even more important now as we have this surge than it has been in quite some time. We do have testing options available in Eau Claire. We also understand that those options are harder to get, that there are more wait times, that the test results are coming back a bit slower. Again, the labs are doing the best they can with turning those samples over, and the test sites have ramped up and are testing a lot of people, but we know that at times it has not been easy. Please go to our website again, the COVID-19 eauclaire.org website. Look at the testing tab to find the various places where tests are available. The National Guard does continue to test out at the site that is on the north side of town at Jacob's Well, and there are many other testing locations as well. Again, go to the site that says testing locations on our website for the most up-to-date information. You can also call 211 for that information. For many people, a really good option right now is to go to our website and look at the home test option that is Vault Test. It's a PCR test. You can order it now. I did recently order one for my household. And you have a home test available to you if you need it. That test is observed via video, sent to a lab, and it is a PCR test. Again, you can do that today. You can go to our site or go to the state website and get one of those home PCR tests for your use. We also know that there are many other home tests available if you are concerned and are finding a home test at one of the local pharmacies. You can use that, but know that getting a confirmatory test is also important if you are positive. Recently, CDC did also change their guidance on if you have a positive test or if you are a close contact to someone that is positive and how long you need to stay home so you don't spread disease to other people. Quarantine and isolation guidance from CDC did change. If you can wear a close-fitting mask, one that fits well, and you can wear it all the time when you are out in public, isolation and quarantine guidance did change to 5 days if you are meeting the other criteria that CDC has named. The health department and health departments across the state, because of the high volume of cases, are not getting to phone calls to every case. That is our typical practice. That is the time that we spend with people to talk and walk through what they need to do if they are positive and what their close contacts are doing. But when we have 2 or 3 or 400 cases a day, which we've been having recently, we haven't, with our capacity, been able to talk to everybody. We have been sending materials. We are asking people if they're getting tested and they test positive to stay home, to isolate for those 5 days, and then wear a well-fitting mask for the 10 days of that complete period. It is important. We don't want you to spread COVID-19 to others, and I'm sure you don't want to either. If you're a very close contact of someone that's COVID positive, quarantine time again remains 5 days if you are not vaccinated and boosted. That 5-day quarantine now, rather than a 7 or 10 or 14-day quarantine with a well-fitting mask, again, 5 days and a well-fitting mask is the new expectation with quarantine. So lots of changes. There's a lot of information about this on our website if you would like more information. And then vaccination. Again, a number of changes have come forward recently related to vaccination. What hasn't changed is our recommendation for you to get vaccinated. If you are fully vaccinated, we also very, very strongly recommend you getting a booster vaccine. It is clear from the recent research that having a booster is important. The booster timeframe now has been shortened from 6 months after your initial series to 5 months after your initial series. So please take time to look at that. Get vaccinated and start if you haven't, and get your booster if you haven't made time to do that yet. Why do we care about this? Again, we want to keep people out of the hospital. We want to keep people from dying. You are 11 times more likely to be hospitalized if you are not vaccinated. You are 12 times more likely to die if you are not vaccinated, if you get COVID-19. We don't want you to take that risk. We want you to be safer, and being safer means getting vaccinated. If you are looking for a vaccination, there are many places to get a vaccination. You can go to vaccines.gov, or you can go to our website. Again, COVID19eauclair.org. There is a simple tab on our website with all the local options. You can, from that site, register, and we really strongly encourage you to do that. We update that as we have new community vaccine locations available. So with that, I will pause. We do have a number of questions that I know came in from the media in advance, and I'll ask Audrey to kind of talk and walk us through those. If media does have additional questions, you can certainly place those in the chat, and we will try to address those as well.
Thanks, Liska. Dr. Mohammed, we had a few questions that came in for you. The first is, how is the Omicron surge impacting Mayo Hospital's ability to treat non-COVID patients?
Yeah, thank you for the question. So the Omicron infection or wave now happening is actually infecting more patients, and that is resulting in more hospitalization and more impact on the healthcare facilities, throughout the country. Any health organization is going through a lot of issues with hospitalized patients. Sometimes also the staff may be out for different reasons. Some of them including the COVID infection itself. So that's resulted in an impact on Mayo Clinic health system, and leading to performing at or near full capacity during this period of time over the last few weeks.
Another question, based on the high COVID activity, are visitation policies changing at local Mayo Clinic facilities?
So the visitation policy is always directed with the pandemic is, percentage at that time. Here at Mayo Clinic, we frequently review the policy and update as needed. We know that visitors for patients, is an important factor in their, our patient getting healthier. So we try and strive our best, to have, visitors, available for our patient. I will definitely refer you to an up-to-date, visitor policy at the Mayo Clinic Health System Eau Claire website, and that will provide, up-to-date information about the policy.
Another question about variants. Are you seeing or hearing of any new variants that could outcompete Omicron?
So currently, there is a new variant that was discovered in France, and that new variant, is not as active as the Omicron as of now. In the United States, the Omicron, as per information from January 8th, Omicron constitutes 98.6% of all of the circulating coronavirus variants. So, it may, it depends on how is the situation, how widely the spread of the infection, what the vaccination status of that group or that geographical area, and that determine like if we are going to see new strains, coming up, But as of now, Omicron is the dominant strain. There is one strain that is covered in France, but as not as widely endemic as the Omicron.
And the last question that came in advance for you, Dr. Mohammed, do you know when the Omicron is forecasted to reach its peak, and what is the downslope after that expected to look like?
Yeah, so as people are going out more frequent or attending more events, we are seeing more of the Omicron or the COVID infections happening now. With a positivity rate, close to 30%, that's a significantly high number. So it usually takes a little bit longer until it gets to the peak. The estimated projection that will be as the peak will be around the end of January, and then after that there will be the decline on the peak. However, it's not very clear how long it takes for that decline to happen. Definitely, this wave is much and more significant than the other waves that we encountered here. And but there's the good part about that is that hospitalization and the death from is not as high in terms of prevalence compared to the other waves that we had before.
Lisa, a question for you that came in. Do you know the prevalence of Omicron versus Delta locally or in Wisconsin? And then how do health officials know which variants are present as part of that testing?
Yeah, I think, Elizabeth, do you want to talk more about that part? Yeah.
Yeah, I can address that. In Wisconsin, there are multiple reference labs that do test a small volume of the positive cases that come in for COVID-19. Those reference labs include State Lab of Hygiene, which is our biggest lab doing that work. Right now, State Lab of Hygiene is reporting that in Wisconsin, 82% of the variants are Omicron. We know that that is rapidly increasing, and as described across the US, we're seeing a very high number. We don't have data at a local health department level or a county level at this point in time, but 82% in the last week of December is the data that we have available.
And with the Omicron surge, are we seeing an increase in people getting tested? Is that leading to longer lines, and how long does it take to get results?
As I said earlier, we do have many, many more people that are symptomatic and many more people getting COVID-19 because of the contagiousness of this variant. Yes, we have many more people also getting tested. So it is reported to us, and we meet with providers across the Chippewa Valley regularly. And this week they did report that testing slots are more difficult this week to come by. Some places the lines are longer, is the report that we are receiving. There are some tests available, and as I said earlier, looking at our website for the various resources and getting one of the tests that the state can send to you, the Vault test, is another option that people can and should explore.
Regarding testing again, if it takes a few days to get test results and the isolation time is 5 days, can you talk through what people should do while they're waiting, if they're waiting a while to get an appointment or their test results?
Yeah, if people have symptoms, they need to stay home. I think that's the first information to share with people. Right now, we need to not have disease circulating. It might not be COVID, but certainly if you have significant enough respiratory symptoms or other symptoms that you're seeking a test, you don't want to pass that to anybody. So stay home if you're not feeling well. The expectation is that if someone's gotten a test, that they stay home until they get the results. Again, that isolation period right now is 5 days, returning back to work or school on day 6 if a well-fitting mask can be worn. In some small number of situations, that may mean that you may not get the test result until you are close to being out of isolation. And while we're in this peak and while it may take a bit longer for test results to come back, our ask to be safe for people around you is to stay home until you either get the test results or you complete that isolation period.
Now about masking, is the county considering an indoor mask ordinance again? What would have to be done or who would have to vote on that to put it in place?
In previous parts of this pandemic, we did locally have a face covering ordinance that was put in place by the county board and the city council. We are not, as far as I know, having exploration of that right now by either of those elected bodies. Certainly, the very strong recommendation continues to be to wear a face covering when you are out in public. It does make a difference. The science is really clear that it's possible to wear a face mask and it makes a difference. And why wouldn't we want to do that for our friends and neighbors and community members? Some local establishments, including the county courthouse and other spaces in the city hall, are mandating, as are our healthcare institutions. And I encourage others to take that lead. It makes a difference when you walk into spaces where there's shared air that you're wearing a mask, both to protect yourself and to protect others.
Is a vaccine ordinance being considered?
There's no vaccine ordinance being considered, no.
And the final question in advance, now that at-home tests will be covered by insurance as of January 15th, are you concerned of a testing shortage locally? And can you provide some guidance to people as whether they should get a PCR test or an at-home test?
There are many options for testing now that we didn't have before, which is good news. Home testing can play a role in people screening for whether they have COVID or not. They're not 100%, but for some people, that is a quick check if they are worried about going into a higher risk setting. For example, going to visit grandma, and you want to check quickly to see if by chance you're asymptomatic and have COVID-19. So those home tests and the ability now for insurance to cover them is one step for all of us, one piece of the puzzle or one tool that we all have. PCR testing and antigen testing done in our provider spaces or at community testing sites remains important. Those PCR and antigen tests do provide the diagnostic test that is needed for many different reasons. Certainly, if there are requirements around isolation and quarantine that are in existence, and we do still have those as part of our state, that you are required to isolate with those positive tests. But also really to make sure that you have a test that if you need treatment, that you can get the appropriate treatment. And that does require also those PCR or antigen tests. So many reasons why we want all of those tools in the toolbox. And We know that at federal and state level, they're ramping up those available resources. We know they're in short supply right now across the US, but we're expecting to see, again, more available resources in Eau Claire fairly soon.
From our media partners that have joined on the call today, are there any additional questions for either Dr. Mohammed or for Liska?
All right. Again, thank you to the media. We appreciate you joining us today and sharing with the community some updated messages. We know that many people count on this way of getting information. For people in the community, a reminder that yes, we are in a surge. Yes, there are some things that you can do to help right now. Please look for more information if you need it at the COVID-19 eauclaire.org website. There's a lot of good local information there that we think will be helpful if you're looking for a testing location or looking for a vaccination location or looking for more information if you test positive or are a close contact. Again, thanks for joining us today, and thank you to Dr. Mohammed for joining as well.
Thank you so much.